Thank you very much. Good morning, ladies and gentlemen. I have some slides. I'm going to stand at the podium. Thank you very much for the opportunity to be once again part of this conference. My key message today is that measuring and monitoring the performance in cancer care is important because what gets measured gets done. And let me give you some background. 2 years ago, we started an international initiative with the support from MSD, aiming to facilitate the exchange of best practices in cancer care across Europe. It's had its background in the launch of Europe's Beating Cancer Plan and the fundamental question of how to turn political commitment into action. As we just heard, one recommended way to take comprehensive action is through a national cancer plan. And with this in mind, we created a cancer dashboard for Greece. We launched the dashboard in October last year. You see it here on the screen. It was very much a team effort. We got great support from Dr. Senia Saridaki, representing ESMO, and from George Kapedenakis, representing ELOC. So we're really, really proud of this work. And on my second and already final slide, I'll show you the big overview of the dashboard. It's crowded. There are lots of content is on this in this overview. Lots of colors, many rows, many columns, but it all follows a clear structure. And let me walk you through this. On the left-hand side, the first column includes 7 areas, starting with governance, then disease burden, then economic burden, which are 3 contextual areas when we talk about cancer care. And then we included the 4 pillars of cancer care. We included prevention, early detection, diagnosis and treatment, and then survivorship. And for each of those 7 areas, we included a number of key performance indicators, KPIs, that are supposed to measure the performance of Greece. And of course, we did not include everything. We could have certainly included even more KPIs, but we had to start somewhere. And in the second column, you see then the status quo of Greece's performance for all of these KPIs, and you see that they have different colors. Red color meaning that Greece is below a European benchmark or the European average. Yellow color meaning that Greece is close or at the benchmark or close to the EU average, and green color meaning that Greece is above the EU average or the benchmark. The third column then simply shows you which KPI that we used. And the fourth column is also very important. It shows you whether there has been any recent policy development, any action being taken, with green color meaning that action has been taken, legislation has been put in place, yellow meaning that there are plans to do so, and red color meaning that there are no concrete actions yet being planned. What is then the general picture that we see here? If we look at the second column again, at the status quo of Greece, we see that red and yellow color dominates. So in most of the areas, it seems that Greece is still below or close to the benchmark. But when we look at the fourth column, the recent policy developments, we see actually lots of green color. And this is a positive sign, and I think we've already heard it this morning from the Minister of Health, because there has been a lot of action being taken very, very recently, and we need those policy actions first to be able to change the status quo in the coming years. So it actually looks very promising. Let me also give you two examples. One that was just mentioned, smoking. In the area of prevention, the status quo is in red color because the smoking rates in Greece are quite a bit above the EU average. But the policy development is in green color simply because the tobacco control ban has been included in the National Action Plan for Public Health. So action is being taken. And the second example that I would like to give you is biomarker testing, also something that has already been discussed this morning. The status quo, we put it here in red color, and also the policy development is in red color. And this is because we published the dashboard in October, and back in October there were no plans yet to improve the reimbursement situation of predictive biomarkers. Now, probably with the announcements having been made, it should probably, we have to change the color. Instead of red color, it should be yellow or even green color in the coming months. And this emphasizes actually a very important point that I'd like to make, that this dashboard is not a static view. It should really be a dynamic tool. And in my opinion, such a dashboard should be updated at least once per year to really reflect the current situation. So with that in mind, I'll already like to round off my presentation. I hope that this work with the dashboard can inspire the creation and introduction of a national cancer plan in Greece, hopefully taking a comprehensive approach, hopefully including measurables and very clear goals and KPIs. And then also once the plan is there and is being implemented, trying to use a dashboard style approach to monitor the implementation of the plan and all of the promises made very, very closely. Thank you very much.